Do you need a lift with your implants? That's such a great question. We're going to answer it today. So the first thing you have to talk about is how much droopiness do we really have, right? And we can define droopiness in different ways. So the one we all think about is how the breast ages kind of off the chest and down with gravity, right? And it's kind of like spilling over. What we're really going to kind of parse through here is separating the breast tissue itself from maybe the nipple position and then the overall position on the chest wall. So the first one's the easy one to remember, and that is how much of the breast is overhanging our breast fold, okay? And that's glandular ptosis, okay? Glandular droopiness. The other concept is where the nipple position is. If the nipple is low, then that's nipple ptosis, right? Or nipple droopiness. And that also can be something that we reposition with a lift. The final concept though is the overall position of the breast on the chest wall. So some women have a naturally low breast position on the chest wall. Just means that where the footprint of the breast is relatively low compared to their clavicles and their belly button. And they may not actually have any overhang of their fold. Everything's still up on the chest. It's just sitting low on the chest. And that's actually a separate problem. So the first patient who may have overhanging breast tissue and a low nipple position, those patients would need a lift, even with their implants for most cases. And I have great information on Instagram about that too. The second group of patients where their breast footprint is just low on the chest, but they don't have a lot of overhang. Unfortunately, in that situation, there's really nothing to lift, right? At that point, it's really bringing the implant down to the breast. And so it's important for those patients to know and understand that after surgery, they may have a low breast look, even though they don't have drooping of the breast itself. And so it's an important distinction for those patients. Now, let's say that we think we have a little bit of droopiness and we may need a lift with our implants. How can you tell? Well, I think it's a pretty simple way of looking at it, but grab something with a straight edge that's relatively firm, obviously not sharp. A ruler works well here also. And you essentially just slide this up underneath the breast, up until it meets the bottom of the breast where the breast meets your chest wall, which is your breast fold. And then you're just looking at how much of the breast is overhanging that object, okay? You can do that and should do that on both breasts, okay? That's important because it's very common that we have some asymmetry and one breast is hanging lower than the other. Obviously, when you're making a decision about getting a breast lift with your implants, you have to fashion that over the droopiest of the breast, right? So even though one breast may not have much droopiness, you wouldn't just put an implant on that side and an implant on the droopier side, then it's not gonna look quite right. So you would probably need at least a lift on the droopier breast side, if not both sides. So, so always assess both breasts for the amount of overhang. If the amount of the breast is overhanging and it's 10%, 15% of the overall volume, then you might be able to get by with an implant alone to mask the droopiness. It doesn't really ever fully treat the droopiness. Again, refer back to my information on our website and social media. But if 50% of the breast is overhanging the breast fold, then those patients are going to be much better served by lifting the breast tissue back up to the implant, as well as nipple position. So it depends on both factors. If you found this helpful, come check out our other information on social media or our website, alamoplasticsurgery.com. We look forward to seeing you and helping you achieve your goals.